I guess we'll get started. It may be sort of confusing for those of you to see this guy standing up here talking about living a long time and being happy and healthy, and then he starts coughing. But it's part of the whole facade, don't worry. I'm not really coughing. Anyway, it's an honor and privilege and pleasure to be here today. I have a long and wonderful history with this organization, and the beat goes on. There will always be people with Chiari malformations and Syringomyelia and many more who have related conditions that share very similar challenges and very similar journeys in their lives. And I've stood up here over many years and many meetings and talked about how to do surgery and how we choose who to operate on and when and how to operate and how to follow up and all these things about genetics and about new innovations and diagnosis and treatment and new pain regimens. But when it comes down to it, one of the subjects that I've never really thought was really presented at a meeting like this, where you have a combination of people who have been affected by the disease, either themselves or their family or their friends, or you are a physician or healthcare provider taking care of someone. And the word that was always missing in my mind was holistic. How do we look at people as more than patients? How do we figure out at the end of the day when their wound is dressed and they're discharged from the hospital, or when they leave your clinic with a prescription, how do we figure out how to influence their quality of life, their length of life, and their happiness? So these next few minutes, I'm going to share with you what I've been involved with. You might wonder why I'm interested in longevity, but if you aren't wearing your glasses, you won't have to question that. But I'd like to share with you what I've learned recently about some simple ways to change your life and to improve your quality of life and to extend your life to everybody's benefit. And so fasten your seatbelts, we're going to take off. Good start. Okay, let me try that. No. Will this work now? Same thing's happening. Okay. What's upside? Okay, upside down. So this is a picture of a recent patient of mine, actually in the last couple months. And this is what I usually talk about. I usually talk about people who come into my clinic and they've been diagnosed as a Chiari malformation, and some of them have signal in their spinal cords. Okay, there it is. They have signal, as you can see here, that may represent a collection of fluid, and they are having an array of symptoms, which, as you know, can number in the hundreds if you go online. And some of them actually assimilate new symptoms after going on the website or reading more about Chiari from the most important consultant in the United States, Dr. Google. But in general, most of them suffer the same disease, and that is that they were born with a situation that blocks their spinal fluid flow and creates an array of signs and symptoms that really affect their quality of life and often don't begin until later in life, sometimes as children, sometimes as young adults, and sometimes post-trauma. They're diagnosed, but in general, it's this alteration of normal spinal fluid flow that creates these signs and symptoms, which can become increasingly disabling. And you can see here that this blockage occurs, and you see post-operatively how the foramen magnum and posterior fossa are open. And this is called a cine. This is a motion picture of an MRI. And you can see the white and black in that foramen magnum signifying that now there's flow through that area. And so this is the good news. And you see the patient post-op has no more a trace of any signal. The syrinx or pre-syrinx is gone, and the patient's slowly improving. So this is the scenario that most people like myself, surgeons, neurosurgeons, deal with all the time, and this is a happy ending so far. But one must realize that beyond that, there's a lot of issues. And one of the most important lessons that's very difficult for people is not to dwell in the past and what happened and focus on all the things and why me. And I recall after the earthquake in Haiti, I was thrust into a situation where we were amputating limbs of crushed victims the day after the earthquake on a kitchen table with very little in the way of anesthetic. And when we finished, the children would look at me and say, "Thank you, doctor." You know, instead of "why me?" or "I can't believe this happened," or screaming. And it's just interesting, the whole range of possibilities of human behavior and what people think is important and how they react to certain situations. But the most important thing, is to really put this important concept into your brain and realize it doesn't do any good to look back, and realize how important every new day and every precious moment is with yourself, your family, your friends, your work. This is something that you've got to reboot your brain and focus on, because telling the same stories over and over again, that's something relegated to guys in my vintage. And my kids, out of respect, roll their eyes in the back of their head when I start. But the truth is the future is more important, and the present is very precious. And, you know, there's no doubt that happiness plays a role. And everybody says, "Oh, wow, this is one of those weird talks about get happy." And that doesn't mean go to Colorado and, you know, smoke the bong. What that means is, what happiness is something within you that changes the way you feel. And a lot of people look at happiness and they say, "Well, what does that mean?" But guess what? Some very reputable, credible, experienced scientists, especially in public health and behavioral medicine, psychologists, psychiatrists, they've studied happiness, and they've made prospective, randomized, controlled studies over many decades, not many days or months, but over years and years. And they found that happiness is directly related to longevity and wellness. 100% guaranteed. This is what we call evidence-based medicine, not speculation. So it's very important for you, especially with this very rare and challenging condition that can affect so many aspects of your body, to really begin to look at the science, read the literature, go to Dr. Google, and figure out how you can change your mojo, how you can put yourself into this mode. And it's very important that this isn't a new concept that Barth Green brought to Orlando in July of 2018. This is something that's been around for a while, and it's something that great minds have thought about, discussed, and appreciated, although they didn't have the data several hundred years ago necessarily. And so this is very important. Social bonds, interpersonal communication skills, being outgoing, communicate, talk, relate, and these are the 6 areas that the psychologists focus on when they try to get people to reboot their whole psyche and get into a positive mode. And this is important to set long and short-term goals. I met the CEO, and I meet a lot of people because they're paralyzed, but his number 2 guy of the number 2 ranked Fortune 500 company was paralyzed in a cruise accident. And we had spent a lot of time together at his bedside and trying to help him. And he taught me something. And this guy was high-level Wall Street, brilliant, top, decision maker in our country. And he said that every 5 years, people should grasp something new in their life. It doesn't mean changing your spouse. That can be very expensive. But it can be something you add to your life, a different dimension, a different work, a different exercise, hobby, travel, something different to your life. And that gives you a sort of a supercharge to go to the next level. But this is important. Set goals, Whoops, hitting too many buttons. So, how is this all related? Well, there's all of these very credible studies. There are many studies that show that stress is a major issue. It affects your whole body, and people that have recorded positive parameters for stress have a shorter life and a larger array of illnesses that inflict their every day in their life. And cardiovascular, of course, are always at the top. This is one study over nuns who lived in the same monastery. The same convent. I need my coffee. Over many decades, and they lived and ate the same food, wore the same clothes, and had the same daily ritual. And the ones who were outgoing and positive and happy lived 15% longer. This is documented. These are prospective studies. So happiness is very important. And we'll talk about wellness. They did the same with other studies of university students and other groups in our society. And then there's a lot of basic laboratory studies on animals that show stress is a great, great life reducer as far as your longevity and your wellness. So it's important to figure out what to do about it. This is a very interesting gentleman, Dr. Barry Sears, a PhD nutritionist, who wrote a book about zones, and you can look this up and read it. And it talks about places in the world, in the U.S., Afghanistan, all over the world, where people live over 100. And then he looked, what are the common things between these people? Well, he found out that they eat a Mediterranean diet based on fish, fruit, and nuts, that they sleep 7 hours a day, and we're going to talk about these things, that they are healthy, they are active. When they see steps or an elevator, they take the steps. They spend 1 day a week spiritually, whether it's their religion, their family, someone they love, but it's a spiritual time that they carve out every week of their lives. All these things add up. They don't run triathlons, but at least 3 times a week they spend a half an hour doing aerobic exercise, something that makes them sweat, not just walking, but something aerobic. And we'll talk about those opportunities as well. But all these things together, even though these people are from different cultures, different religions, different geographies, different genetics, these people uniquely share a long life of wellness and happiness. So this is really important. Now, he's focused on a diet that's balanced between protein and carbs, and we'll talk about what are the benefits of some of these diets, but there's no doubt that this is an important thing. Nutrition, you are what you eat, and we'll talk about that repeatedly. And anybody who doesn't believe it is putting a blinder over their eyes, because there's a direct relationship on how long you live and what you eat. And all these fancy, expensive diets, are not as effective as something, 2 words, it's called portion control. A large breakfast, a moderate lunch, and a very light dinner. And why is that? Because you don't burn the calories when you're sleeping, you burn them during the day. So you've got to reboot how you give your body these calories and what type of calories that you consume every day. Very important. Your diet. This is my little, I won't lie, this is my closet full of drugs. And but these are okay drugs. And these are things that I prescribe every week for my patients. When someone comes in my office with a Chiari or a spinal cord tumor or paralysis from an accident, I try and look past their neurosurgical problem, and I always spend a few minutes finding out about them, like the old song, Who's Your Daddy? And I want to ask them if there's anything I can do to impact their lives. And we talk about these issues I just brought up with you. But these are some specific supplements that I use or I recommend for my patients. And one of the most common things in my Chiari patients is having a good regular bowel regimen and what are called probiotics, and this is just one of them, Culturelle and magnesium, over the counter is a good combination to avoid, a focus, on having a movement or being constipated or being uncomfortable. The next one is just a heart supplement, coenzyme Q, that is very important and been shown in evidence-based studies to help protect the heart. The next is for the calcium and vitamin D. And people with any type of physical challenges and disabilities have a high propensity to osteopenia and osteoporosis. And men have osteoporosis. I have it. It's something that should be recognized and treated. And it's very important that you have a bone density at the right time and that you follow that bone density if you have an abnormal one over a couple of years. But a daily dosage of vitamin D, and calcium is very beneficial. And I use Tums instead of those big calcium pills. A couple a day is equivalent. These are vitamins, supercharged vitamins. One brand is called Alive. It's a liquid. And if those of you that are in my generation will remember cod liver oil and these horrible vitamins we were forced to drink and ingest, it's back again. And Alive is like 100 times more potent. And my European colleagues always make fun of Americans. They say, how do you know an American, is in a room in a party, and they say, well, that's the only one in the room that speaks one language. And then they say, but how else can you tell? And they say, well, when they go to the bathroom, you can analyze their urine. It's the most expensive urine in the world because it's full of all these supplements and vitamins. So this one on the right is very important for everybody, and that is part of what is provided by a Mediterranean diet, heavy in fish. And omega-3 or fish oil is being really been reborn as a opportunity to do everything. This is a very potent formulation that you keep in the freezer, and it tastes horrible. It goes right through clothes and plastic dishes. But the fact is, it has a profound effect on your lipids, triglycerides, all the things that affect aging and vascular disease. And so a teaspoon a day of this generally has a tremendous protective effect on the heart and the brain. And there's a huge growing literature on the effectiveness, even dropping the A1C in diabetics or pre-diabetics if it's taken at a proper dose. So this is something that Dr. Sears has one of the top products, but it's expensive, but when it comes down to it, it's pennies a day, and it's worth it. So what about people like yourselves who have been injured or have a disease or a congenital problem? What do you do with your life when this catastrophic event or diagnosis or surgery occurs? Well, you have a choice. And I say this every day in my clinic, twice a week. I'm there 12 hours, and I see a lot of patients with cancer and chronic disease. And I tell them it's your choice. You can come here and complain and deteriorate and just really go into a negative spin, or you can decide to be proactive. Every cancer patient, for example, is given chemotherapy, radiation therapy, more recently immunotherapy, but something that they can do about it is every day, 7 days a week, aerobic exercise and supplement your proteins, because the combination of protein and exercise has a profound effect on your immune system. You can buff up your own immune system. And it's very important when people have chronic disease, injuries, recurrent surgeries, that they do something proactive. They don't just passively wait for the next MRI or the next diagnosis or the next medication, that they do something to keep their body optimized. And they've got to be proactive, because being passive doesn't work. And this is my own little recipe. I drink one of these Core Powers every day and eat a power bar, because I'm at work all the time. And it's very important, and this isn't necessarily as good as natural diet, but in situations it can be helpful. Strong immune system, very important. Now, what type of aerobic exercise? People say, well, I go for a walk. That's not aerobic exercise, unless you're really a power walker, a competitive walker. Aerobic exercise means you start out exercising and you start to breathe a little heavy, but you're doing aerobic exercise when you start to really sweat. And that's the important thing you can achieve on a treadmill. You don't have to run. That's not necessarily good for people with osteoporosis or back problems or neck problems. But a treadmill, a recumbent bike, you can swim, you can do an elliptical bike, but there are good ways, and there's access in everybody's community, in their house, to this type of equipment, but you have to take the time to do it. And it's very boring, actually, to be honest with you. So that's why I put it in front of the tube, and I'll watch one of the 3 channels that tell you the same bit of information in 3 totally different ways. And you sit there, and that keeps you awake while you're doing the 10 more minutes and 10 more minutes and 10 more minutes. But aerobic exercise is very important. Now, what about meditation and spirituality and mindness? Everybody sort of jokes at the people humming and meditating and stuff, and it's not something to laugh about, because, again, good scientific data shows people that have this type of ability to just stop everything and take a deep breath and lower their stress and focus on just nothing, it becomes just as therapeutic as eating a protein bar or spending 30 minutes on my treadmill. It's very important. And this is really something that you'll be amazed how. Now, have I ever gone on a retreat for 2 weeks or a yoga seminar or gone up to the mountain? And no. But I definitely try every day to spend some time in this area, because, and it's something, again, if you don't know what it means, that you can surely get into it through Dr. Google. But the specialty I'm in, spine surgery, used to always talk about the importance of yoga and stretching and flexibility. But today we realize that the opposite has a better long-term effect on your happiness and your health of your spine and your body. And that's more of a Pilates approach, core strengthening, posture. Don't do what I say, what I do what I say. But it's very important to have a strong core. And especially some people have associated Ehlers-Danlos syndrome with hyperflexible joints. And the worst thing you can do to those people is say, go do yoga, because that further stretches out the joints and creates pain and you know, the crepitance, the loud noises that occur every time you move around. It's better to tighten things up, have good posture and good core. So these are all important things that I've learned. And this mindfulness isn't necessarily through meditation. It's a matter of what parents discovered years ago when they sent me to the corner and they said, it's time out. And then when time out occupied most of a 24-hour period is when I left my home, not by choice. So don't do what I did, do what I say. But mindfulness is very important. It's something you all can look into. You can look it up, you can figure it out, and you can get people to help guide you in this area. Very important. It's part of that spirituality. Some of you may know this guy and think about him in different ways than Abraham Lincoln, but this is another guy who comes up with some pretty thoughtful statements. And some of you are here today because of that. A lot of the healthcare providers and physicians are here not because they're not reaching in their own pockets to pay their tickets or whatever, but because they care about people, because they're generous, because they woke up this morning and say, instead of being at work or with my family, I want to be with the people who I can help, who I can improve their quality of life, who I can make a difference with. And there's a very special group of healthcare providers in this room today who care about people with Chiari and Syringomyelia and how their quality of life is affected. So it's very important to think about that. Now, everybody takes for granted sleep, except those of you who don't, like most of us. And what these studies have shown is the best longevity is achieved, the best wellness and happiness with 7 hours a night of sleep. Not 8, not 6, not 10 or 12. And sleep is only important and effective if you have a good, deep, what they call a REM sleep. So just sleeping and dozing off and waking up, covers off, covers on for the women with hot flashes, you know that it's like being tortured. And you wake up in the morning like you've been in a battle. So it's very important that you use adjuncts to help you sleep. And some people, especially people who are obese and have certain conditions, lung conditions, find that CPAP, using assisted breathing at night, for various reasons, allows them to improve their quality of life, their health, their wellness, and longevity. But just think about that goal. Also think about where you sleep. Think how much money you spend on your car and other things, your clothes, and think how little you spend on your sleep platform. Should it be extra firm? Should it be electric, going up and down? Should it contain different modalities to help? I've even seen a bed that's manufactured in Orlando that has a cabin under it for pets. So there's all kinds of sleep platforms, but it's very important where you sleep and that you invest in this platform because you're going to spend a lot of your time there. They even computer design these for a husband and wife or two people in the same bed who have different morphometrics, weights, heights, and the different sides of the bed, you know, can be custom made, which is a good thing, bad thing, since there's a big fence now in mine saying this is my side, and I don't get it. But anyway, it's very important, though, to not underestimate sleep. The next step, what about people in this room? What can you do to change your life? Obesity is a tremendous life shortener, and it's a choice. Everybody has a choice, and some people need help because their thyroid is malfunctioning or other issues that they can't necessarily control. But everybody can change their diet, and they can control their portions if they want to, and you can get professional help, and some people can benefit from bariatric surgery. So there's a lot of options, but part of it, again, is being happy. You've got to be happy with yourself, with the way you look, the way you feel. And your appearance has something to do with longevity, how you take care of yourself, how good you feel about yourself. It's very important. Now, these are very different people. I don't know if you can read these quotes. Don't cry because it's over, smile because it happened, by the famous Professor Zeus. Count your age by your friends, not years. Count your life by smiles, not tears. John Lennon. The most important thing to enjoy your life is to be happy. It's all that matters. Audrey Hepburn. A happy person is not a person in a certain set of circumstances, but rather a person with a certain set of attitudes. Hugh Downs. Every morning when I open my eyes, I say to myself, I, not events, have the power to make me happy or unhappy. I can choose which I shall be. Yesterday is dead, tomorrow hasn't arrived. I have just one day today, and I'm going to be happy in it. Dr. Groucho Marx.
Okay, so hello everyone. I'm Sam, and I just turned 17. So I'm going to give you some more information about progeria. It affects only about 350 kids today worldwide, so it's pretty rare. And effects of progeria include tight skin, lack of weight gain, stunted growth, and heart disease. Last year, my mom and her team of scientists published the first successful progeria treatment study. And because of this, I was interviewed on NPR. And John Hamilton asked me the question, what is the most important thing that people should know about you? And my answer was simply that I have a very happy life. So even though there are many obstacles in my life, with a lot of them being created by progeria, I don't want people to feel bad for me. I don't think about these obstacles all the time, and I'm able to overcome most of them anyway. So I'm here today to share with you my philosophy for a happy life. So for me, there are 3 aspects to this philosophy. So this is a quote from the famous Ferris Bueller. The first aspect to my philosophy is that I'm okay with what I ultimately can't do because there's so much that I can do. The next aspect to my philosophy is that I surround myself with people that I want to be with, people of high quality. I'm extremely lucky to have an amazing family who have always supported me throughout my entire life. And I'm also really fortunate to have a really close group of friends at school. The third aspect to the philosophy is keep moving forward. Here's a quote by a man you may know named Walt Disney, and it's one of my favorite quotes. I always try to have something to look forward to, something to strive for to make my life richer. It doesn't have to be big. It could be anything from looking forward to the next comic book to come out, or going on a large family vacation, or hanging out with my friends, to going to the next high school football game. However, all of these things keep me focused and know that there's a bright future ahead and may get me through some difficult times that I may be having. Now, this mentality includes staying in a forward-thinking state of mind. I try hard not to waste energy feeling badly for myself, because when I do, I get stuck in a paradox where there's no room for any happiness or any other emotion. Now, it's not that I ignore when I'm feeling badly. I kind of accept it. I let it in so that I can acknowledge it and do what I need to do to move past it. So, all in all, I don't waste energy feeling bad for myself. I surround myself with people that I want to be with, and I keep moving forward. So with this philosophy, I hope that all of you, regardless of your obstacles, can have a very happy life as well. Oh, wait, hang on a sec. One more piece of advice. Never miss a party if you can help it. My school's homecoming dance is tomorrow night, and I will be there. Thank you very much.
Sam passed away the next year. He was going out to throw the first pitch at a baseball game, which was his dream, and a professional game on national TV, and didn't quite make it. But what an extraordinary role model. He looked 80, but he was 17, and full of optimism and full of gratitude for the preciousness of every day and the importance of his family and friends. And so whatever's going on in our lives, we got to put it in the right perspective and realize how precious every day and every moment are, and that together, people in this room can make a huge difference to so many. Thank you very much.